Huge shout out to the National Association of Hispanic Nurses for hosting the Hispanic Health Policy Summit and allowing Hispanic Latinx nurses from all across the nation to descend on Washington to learn more about health policy and advocate for our workforce. First up, we had Mildred Espinosa with EBLA Digital, who spoke on mastering media for advocacy and impact, specifically as nurses.
Not that you're giving and you're not important. You're very important because you create opportunity for different outlets to actually, the media, to really understand where are those opportunities for general market? Where are those opportunities to connect and partner with?
We then heard Vincent Guillermo Ramos speaking on redesigning the U.S. broken health system.
Also true is that what's happening right now simply doesn't reflect right now. There are historical antecedents and have been well established for quite some time. Here's some of the areas that I want to talk about. Starting from issues that we faced prior to this moment around access to care, the quality of our care, the cost of our care, our life expectancy and morbidity, particularly multimorbidity from chronic disease. These are things that are not new right now.
We also got to hear such an impactful story from Patricia Neese with Obesity in Action on breaking barriers to obesity treatment and how this affects the Hispanic Latinx community.
I'm here to tell you that you are very trusted. I spent 2 weeks in Georgetown Hospital a couple years ago. I basically sheared the skin off my leg. I'll spare you the details. You should also know that Black and Latino people have higher rates of obesity, according to the Trust for America's Health, than other people, mainly white people. Same thing for youth.
We even got some direct industry updates from Cynthia Hicks and Sharon Lamberton, who spoke on PBMs and legislation regarding prescription medications in the United States.
The PBMs that never touched the medications, but had a role about 40 years ago to actually bring a good negotiating rate between the manufacturers and health plans. Now they take over half of the spend of medicines, and none of that goes to the patient, which is wrong. And it's being addressed on the federal and state level, just not quick enough. I just wanted you to see kind of where we are and how many different players that legislators have to listen to. And that's just bringing a drug into the stream. The healthcare provider is one of the most important part, which are you, and you're interfacing with the patient. There's a lot of different people in the supply chain.
We got to hear about advancing equity and healthcare policy solutions to address rare diseases by Caitlin Schneider and Gerardo Crespo from Amgen Biotech and Jeanette Contreras from the Latina Health Collab.
Insurance company of getting prior authorization, getting approvals, right? If you just have, like anybody has regular employer-sponsored health insurance and you're trying to get approval for a medicine that's not indicated for your condition, you have to go through an appeal process to get that approved, right? So, of course, this leads to not just worse health outcomes, but when you're dealing with some of the neurological rare diseases, there are significant, you're at more significant risk for disability and for, long-term irreversible conditions.
Regarding social and climate injustice, we got to listen to Dr. Roxana Chicas from Emory University, who spoke on her solution-driven approach to supporting our farm workers.
So really important that guidelines are not rules, they're guidelines to help you give recommendations. All right, next thing we found was that they live in a chronic state of dehydration. Half of them go into work dehydrated, and by the end of the workday, 81% of them are dehydrated.
We got to hear an incredible speaker, Claudia Romo Edelman, founder of weareallhuman.org, regarding America's healthcare workforce and the impact of the Latino community.
So let's not get fixed on any labeling, because at the end of the day, what really matters is the meaning of how are we going to deal, how are we going to make sure that when we're talking Latinos or Hispanics or whatever you want to use, at the end of the day, it means progress, it means power, it means prosperity, right? Yes. So these...
To round out the day, we heard from Ariel Gonzalez about legislative process and preparation for Hill Days. We learned about what advocacy is, what lobbying is, and had some really great examples as to how we can actually meet with our representatives.
I've been able to build sort of my name in Washington by working for a variety of stakeholders And my goal was always to get like a 360 point of view of healthcare from, providers, physician groups, nursing organizations, patient groups, pharmaceuticals, labs, older Americans at AARP, maternal health care with March of Dimes and others. And it's been a fun ride, and it's really kind of cool to see the entire.
With day one of the summit done, we still had a lot of work to do. Had to take a look at our advocacy to action, empowering Hispanic nurses to shape the future of Latino healthcare, and our call to action for Washington, which was to support our nation's nurses by prioritizing two key initiatives: the Title VIII Nursing Workforce Development Programs, which are essential for increasing the number of qualified nurses and supporting both current and future nursing professionals, and the National Institute of Nursing's research, which funds critical research to establish scientific foundations of quality patient care. The National Association of Hispanic Nurses urges the 119th Congress to support legislation such as some of the bills that were introduced by the previous Congress regarding topics such as access to healthcare, healthcare education and the workforce, and the impact of climate on health. To start our second day of the summit, Ruby Alba de Hickson and Lois Lopez spoke on anti-DEI legislation and how we need to be informed and really embrace the power of advocacy.
Voice matters in healing. Inclusion means creating an environment where all nurses and patients feel seen, heard, and valued. It's about fostering psychological safety, teamwork, and respect, ensuring that every voice contributes to better health outcomes and stronger nursing practice. Belonging, a culture of care for all. Belonging is the heartbeat of nursing. It's the difference between simply being present and truly feeling connected. It's about building a workplace and healthcare system where nurses, patients, and communities feel supported, valued, and empowered to be their authentic self.
Once the summer speakers were done, we got to go off onto Capitol Hill and actually meet with our representatives. I'm from the state of Georgia, so I spoke with the staffers for Raphael Warnock, John Ossoff, and our congressional district member, Lucy McBath. This was such a surreal experience, especially as an immigrant to the United States. I never imagined myself being able to speak with representatives on this level and advocate for not just Hispanic Latinx health issues, but also for the nursing workforce. Nurses really are the backbone of society, and immigrants are also the backbone of society in many ways. So it was so empowering for me to be able to be in this space and represent both of these communities how I did. Just got done with meeting number 1 with Senator Warnock's people over here at the Russell Senate office building. It was honestly really nice. I was a little nervous, but the staffers are great. And the biggest thing that they wanted to share with everybody is that we do need to be reaching out. We need to be communicating with our senators, with our representatives, letting them know how we feel about issues, because it does make a difference. We need to be able to put names and faces to these issues because, like she said, a cut is a cut and it's going to affect actual people's lives and livelihood, and we need to be able to protect them as best we can by sharing stories and speaking up, because our voice matters. Hey, so I just got out of meeting from the Rayburn House office building with the staffers from Representative Lucy McBath. Honestly, it was a great conversation to have with them. She has some really amazing issues that she is a part of. And one of the key takeaways was that nurses have the ability to cut through the noise. I know there is a lot of noise that is happening right now with policies and changes and things that are happening on the day-to-day. But one of the key things that was brought up is that nurses have the ability to cut through the noise because we are one of the most trusted professions, and we have the ability to know our patients, know the people and communities that we work with, and everybody has a personal connection to a nurse, whether it's through a family member or themselves or their friends. So we have to do what we can to stand up and be the voice. Okay, so I just wrapped up my last meeting of the day. This one was on Zoom, so I went ahead and came back to my hotel room so I could take it and I could sit and be warm because it is chilly outside. But the biggest takeaway from this meeting is something that I think will stick with me. Democracy is participatory. This does not function and does not work without our constituents and the folks around us being involved. So our civic duty is more than just voting every 2 years or every 4 years. It is really about reaching out to our elected officials and all of the staffers that work with them to share our stories and share our voice. She let me know that they count up and tally every single phone call, every single letter, every single outreach moment. They pass that on up. So don't stop. Keep calling. It was great for you all to join me for the National Association of Hispanic Nurses Hispanic Health Policy Summit. I had such a great time, and if you want to follow for more, please be sure to follow me at EnfermeraMami.rn. And I'm really excited for all of the stuff that I have coming to you all that I learned, and we're gonna have more opportunities like this. So be sure to follow and be sure to be tapped in with your local health policies information. Hi, so it's my last morning in DC. I went and got some breakfast, got myself a little coffee, and honestly, the view of the Capitol building in the background with a coffee in hand will never get old. And I just feel so grateful. I feel so grateful for the experience that I've had here with the National Association of Hispanic Nurses and the Hispanic Health Policy Summit. I have learned so much about Hispanic Latinx health policy and advocacy as a nurse. I have always felt like nursing is inherently political. It's inherently advocacy. It's inherently education. But to see that in action, to understand what that means and what that looks like, to experience it firsthand, has honestly been a life-changing experience in a lot of ways. And I'm not saying that to be cliche. I genuinely do mean that. I feel like I now have purpose and direction and know how and where I want to take my platform, and I can't wait to take you along with me.